All right, it is 11 o'clock, so we will go ahead and get started. Welcome everyone. You are all here for the virtual speaker series. Today's session is navigating medical transitions from pediatric to adulthood. Today we welcome Tina Crook. She's the lead parent network specialist at the WVU CED. A few housekeeping things before we get started. Please feel free to keep your cameras on or off, whatever you're most comfortable with. We just ask that you attend to the material being presented. Keep yourself muted just to limit distractions for our speaker. If you have any questions, feel free to utilize the chat, use the raise hand option, and then there will be time for questions at the end. So with no further ado, welcome Tina Crook.
Thanks, Allie.
Mhm.
As Allie said, my name's Tina Crook, and I am the lead. Actually, our title just changed from Parent Network Specialist to Family Resource Specialist. If anybody accesses any of our materials, you're going to be seeing that change happen. We're still the same people. We still provide the same supports and resources, just that the name changed. So we will go ahead and get started here. I do want to apologize in advance. I'm using dual screens. You guys are all on this one, but my PowerPoint's over on this one. So if you see me, with my head turned 90% of the time, that's why. I love having the two different screens. It makes life easier, but it looks kind of funny when you're not looking at the one that the camera's on. Um, so today we're going to be discussing transitioning from pediatric to adult healthcare. Just real quick, a little bit about us. We are part of West Virginia University and the WVU Health Science Center. About the CED, everywhere that you see a dark blue spot on this map, we have people that staff that are in them counties. We cover the entire state, but we've got kind of people branched out everywhere. A lot of people through the CED work regionally. They have a big chunk of the state that they cover. But again, every program covers every state. So about the Paths for Parents and Family to Family program, I am going to kind of go over a little bit about who we are and what we do, and then we'll go into today's presentation. So Paths for Parents and Family to Family programs. This is who I work for. We are sister programs. We provide basically the exact same services for families. The only difference is our funding. So the Paths for Parents program, this is funded by the Children with Special Healthcare Needs program. The maternal, child, and family health is where the money comes from for that. And we serve anyone whose child is enrolled in the Children with Special Healthcare Needs program, as to where our family to family program is funded by HRSA grants. So anybody who's not enrolled in the Children with Special Healthcare Needs program would fall under our family to family program instead of the Paths for Parents program. So it's just a difference in our funding, but we provide services to, anybody. So how we help families. So support as parents of children with a disability ourselves, we are able to connect with and have that personal understanding of what it's like to live the life as a parent, to a child that has a special need. So we help provide that support for other families. Advocacy and mentorship. A lot of people, think that we are advocates. We are not advocates. But we do provide parents with the knowledge, skills, tools, and guidance that they need to be better advocates for their child, both medically and educationally. We provide trainings to both parents and medical professionals as well. We help parents find services. We help them get connected to a wide range of resources for their child and family. And this could be anything from finding a provider, medical equipment, finding things, financing for needs that they could not otherwise afford. We help find grants and different things like that that they can apply for to maybe help get something, provided that they otherwise wouldn't be able to get. Connection to, just the lights flickered here. I don't know if you all could see that. Um, Hopefully that's not a sign of things to come. But anyway, connection to other parents is another thing that we do. This is a pretty big one. We get a lot of referrals on this. But we do weekly virtual support groups through Zoom every Tuesday evening at 7. So we've actually got one coming up this evening for parents and caregivers that have a child with a disability. Our support groups, we also have in-person ones kind of scattered throughout the state, and we're growing more and more of those. We've got some in Fairmont, Wheeling, Logan, Mingo, Raleigh, and Gilmer County currently. Let's see. They are not disability specific, so everybody is welcome. If you have a child with a disability of any diagnosis, you're welcome to come. Also, the parent to parent is another thing that we have that we offer for parents. And I'm gonna throw Allie under the bus here real quick because Allie is the lead on our parent to parent program. And I just always love to give a shout out about that as well. So Allie, do you mind? You can explain it so much better than me because that's your forte.
There we go. Parent to Parent is a parent matching program. It is part of a nationwide program. So if your child has a unique or rare, maybe genetic disorder, and there is not another parent in the state of West Virginia, we can look nationwide to try to get that parent best matched with another parent with the same or similar diagnoses. But it's just connecting parents that have kind of gone through the same journey or that are on the same journey that just want someone else to talk to. So it's a one-on-one parent support.
Thanks, Sally. And what I like about the parent to parent too is um, the parent looking for support, they get to pick their method of communication with a support parent. So maybe you're somebody who you're not comfortable being on the phone. You can say, hey, I want to be connected by text, or I want to be connected by email. And that's the only way I'm going to communicate. And Allie works her magic and gets you set up with, the support parent. And then it takes off from there. So, and she's actively recruiting for volunteer support parents as well. So if you are someone or know of someone that has a child with a disability and you're at a stage in your life where you feel like you could offer support to another parent that's going through, that might be going through a similar journey, definitely reach out to Allie about that. Um, so sibling support. This is another thing that we started offering not too long ago. Um, because a lot of times when you have a child with a disability, that child can require a lot more care and attention than what your typical child may. And oftentimes, and I learned this from personal experience, those siblings can feel left out. So the sibling support is we offer virtual sessions, but we can also do in person. Um, where it's just a get together for the sibling only, not the child with a disability, just their sibling. And they can be around other siblings that kind of get it and have fun, play games, and it's all about them for a couple hours. So that's something that we're still working to kind of build and grow in the state. We tried doing it virtual for a while and we just weren't getting enough interest in it. You got to have several children to make it work, but if that's ever something that you guys know of, several kiddos that'd be interested in it, definitely send them my way. Family leadership opportunities. Here's another one. So we offer a couple different opportunities for parent leadership. We have our family to family advisory committee that meets quarterly to discuss needed services in West Virginia. And then we also have Project DOC. DOC stands for Delivery of Chronic Care. This is where we have partnered with the School of Medicine through WVU. This is a parent-led simulation where we take parents of medically complex kids and pair them up with medical students so med students, nursing, pharmacy, occupational therapy, and public health students. The parents get to kind of go in a Zoom room and tell about their journey of raising a child with medical complexities. And these students get to ask questions about what their journey was like, what was good, what wasn't so good, what and the in-between of it all. The goal of Project Doc is to help these learners have a better understanding and just more knowledge about the life that parents have with a medically complex kiddo, in hopes that when they get out there and practice in the real world, they're going to take with them what they learned from these parents and hopefully be able to provide better services to families. So we're actively recruiting for Project Doc and the F2F Advisory Committee as well. So, all right. So that is enough about our program, what we do. We'll go ahead and get into pediatric transitioning from pediatric to adult healthcare. So just a quick overview. This session will provide participants with a deeper understanding of medical transition of care from pediatric to adulthood. You're going to get to see some examples of the lived experience of parents and caregivers, gain a deeper knowledge of different types of medical care transition, planning, barriers, and tools to help with all of that. And then we're also, I'm going to introduce you guys to the GOT transition framework as well. So let's see here. So I am going to click this link and hope and pray it works, guys, because we got a really cool video here about medical transitions that I want to show you all. Allie, let me know. Can you all hear this?
If your hair gets greasy 24 hours after washing, that is not normal. Your hair gets oily super fast, like on wash day. It's limp.
This game is pretty simple. It's exactly what it says on the tin. We are making a nuclear bomb in our backyard, but we're not going to half-ass it. We're going to have to do every single...
Hang on, I think I accidentally clicked another video when I was trying to...
It did come up at first.
Yeah, and then I think I went to click full screen and got over too far and clicked something there, and I don't know how to go back. So I might have to stop share for a second. Let me see what this does. Let me go to that. Let me go to this. Here we go. My name is Tina Crook. I live in Coolidge, West Virginia. When Dalen was 13 years old, he was diagnosed with HSV type 1 encephalitis, which is the common cold sore virus. Instead of getting a cold sore, it somehow traveled into the brain and caused mass infection, which left him with some permanent left frontal lobe brain damage. The pediatric care was good. We moved from like the more central part of West Virginia down to the southern part, and we had to get new neurologists and doctors whenever we moved. That transition, just changing doctors went pretty smooth. The neurologist that we had been seeing put in a referral to one that was more down south. They were really good. They really listened and took their time with Dalen, reviewed all of his charts so they knew kind of what they were getting into from day one with him. The transition from pediatric to adult care for Dalen did not go smoothly. When Dalen was 18, we went for just our regular 6-month checkup, and he said, this will be the last time that we see you, and didn't do a referral on to nobody else. And we were, kind of panicky, like, oh gosh, we need a neurologist. It was a 6-month wait to get in to an adult neurologist. None of Dalen's medical records were transferred to the new neurologist. It was also during COVID. They wouldn't let me go in with him. As far as all the deficits and stuff, he's not real good about explaining that or medication. He can't remember what medications he was taking. By the end of the appointment, they were both frustrated with each other. Dalen walked out with no refills for his medication and no new appointment scheduled.
They might have 5 providers that they see, plus their primary care provider. That difficulty with transition is that they have to see new providers. One of the recommendations I make to families is that you don't want to transition all at once, everybody. You either stay with your pediatric provider as you go through those transitions, or transition into a new adult provider, get to know that person. They get information from the pediatric provider and then make the transition into the individual adult specialty people.
All of the responsibility for the transition was put on Dalen and I. I feel like one of the biggest things that people could take away from this is to just, take a look at his. It didn't go smoothly. Had the pediatric neurologist made that referral for us, sent those records, took a few minutes and called that adult neurologist, months down the road to say, hey, I'm just checking on this patient that I referred. Did they make it to their appointment? Do you have any questions for me? Had he not been able to communicate with them how he was feeling, he may not be with us today because they might not have, known to, let's try this mood stabilizer, let's try this. I think that could really make a big impact as far as transitioning from pediatric to adult health care.
Hi, my name is Anna Smith. I'm from Belleville, West Virginia. When I was in the hospital, I was very sick at the beginning, but my mom talked to the doctors because she's my medical power of attorney. After I was feeling better, the doctors and nurses talked to me. I want doctors to talk to me and ask me questions, not other people in the room. Sometimes I make a list of things I need to tell them about, read it when I get there. I put my appointments in my phone calendar so I know when I have one coming up. I get on my chart and look up the dates. I read my test results and send a message to my doctor. I was scared the first time because I didn't know half my doctors. But as you get to know them, they get really nice and they care about you, about what you're doing. I want to live on my own someday, so I need to be able to speak up for myself. I need people to understand that I can take part of making decisions that will impact my life and health. I want to be here in the world because I want people to know me and love me for who I am.
I have a 19-year-old daughter, Gracie. Gracie just happens to have Down syndrome. So right now we are working on transitioning to adult health care. It's just been really scary, I guess. We've had the same physicians for the last 19 years, so it's uncharted territory. What I say to all families that have children with disabilities when we're talking about transition is to start early. It doesn't matter if we're talking about education or if we're talking about medical care. Don't be afraid to ask questions when you do talk to doctors. One of the things that I educated myself on, again, was turning 18 and everything that entails, applying for Social Security, looking at what our options were as far as guardianship and alternatives to guardianship. I think the thing that scares me the most about transition is making sure that physicians see her for her and don't discount because she has a developmental disability, that her life doesn't matter as much as someone that doesn't have a disability. We want someone that will talk to Gracie, but will talk to me as well.
Hello, my name is Robin Hatcher. I'm from Flat Top, West Virginia, and I want to introduce you to our little blessing. Her name is Haley Hatcher. She is 20 years old, and Haley has Down syndrome. She has severe cerebral palsy. She has something called periventricular leukomalacia, which a significant part of the brain was damaged at birth, which ended up giving her cortical blindness. She also has chronic lung disease and a host of other secondary diagnoses. Within her environment, it's very much like a little mini ICU unit.
I came to be caring for Haley about 1.5 years ago. I was contacted through one of the local hospice nurses who reached out to me because Haley was aging out of pediatric care. Her primary care pediatrician needed to transition her to an adult physician. It was very helpful from the standpoint of my initial contact with the Hatchers that they knew what they were doing. They had a long track record of taking care of Haley. They had a pediatrician who was willing to be available if I had questions. It's always a stressful event to deal with any kind of change, and particularly in a scenario such as this, and then for someone new to step in and try to assume that role, there has to be some time period for that relationship to gel, so to speak, for the physician to be comfortable with what the family members are saying and for the family members to be comfortable that the physician knows what they're doing.
The reason it's so stressful in transitioning is because you have a very complex patient. And I'm sort of a take charge type person. I don't like to sit on things. So as soon as I saw her approaching age 18, I'm the one who pursued the pediatrician, and I had a conversation with him. And he understood, and I will tell you, this is not a man that I would have ever wanted to leave. We had a great working relationship. I asked him, did he know of any physicians that he thought would be good, and he said, let me think about it. But in the meantime, we did have hospice in the picture. Haley qualified for like a palliative care, and these are people who were coming in constantly on a weekly basis. They got to know me and Haley and what our needs were and how complex that she was, and that traveling with her is extremely difficult. So they recommended a doctor that they use to see patients in the area who will travel and see the patients. So that was our connection with Dr. Shorter. He has been a blessing to us. He really came in and I feel like he worked with the pediatrician well, getting the overall history, working with myself to understand, this is really what this is going to look like as far as her daily care, what we do yearly. We've been in this for about 1.5 years now, and I feel like we have a great rapport with one another, and I've gained that respect from him, which is definitely needed. He needed to understand who we were, and we needed to understand who he was.
We meet together at Haley's home every 3 months or so, just so I can get a general sense of how she's doing, and to be brought up to speed by Haley's mother, who is very attentive and probably could passed her boards as a critical care nurse at this point. She really has a very firm idea of what's going on with her daughter.
The number one thing I learned over the years is always listen to the families. You may think you know about what it is, whatever your expertise is, but you don't have near the expertise that families have, expertise about their own kids.
Once you start to see Haley as a person, you're gonna start caring about her like I do. You're gonna start seeing who she really is as a person. This is the person that I'll fight to the death for, that I really care about. And one of the things is just seeing her smile, seeing her interact with you, seeing her listen to a video that she loves or me to sing a song and how she lights up. She's really a real human being that once you see the whole person, I think that's going to help you in really providing her care.
She's living her life, and my job is to help her live that life to its optimum.
All right. So we had 4 families and 4 totally different transitions there. And I am going to do my best to get back to the PowerPoint here. Goodness, I might have to stop sharing for a second, guys. And
hey guys, thanks so much for checking out my show. Really appreciate you guys. Please.
Okay, I don't want to check out your show, buddy.
Support.
Technology is great when it works. Okay, so let me try to share again. It's going to take me right back to the beginning. So I'll have to get caught back up on where we were. Let me get you guys. No, it didn't. Okay. So what is healthcare transition? So healthcare transition is going from a child family-centered model of healthcare to an adult patient-centered model with or without transferring to a new clinician, which we'll get into that here in just a minute. It involves planning, transfer, and integration into adult-centered healthcare. So, let's see. So healthcare transition, again, it's the process of moving from the child family-centered model of healthcare to an adult patient-centered model of care with or without transferring to a new doctor. So if the child's physician is a primary care physician, sometimes that transfer is not needed because they see adults as well. Luckily, my children, when they were little, we did pediatric doctors, but as they got older, we went to family practice. So when they turned 18, we didn't have to, that was one less doctor we had to transfer to adult care from. But if your child is seeing a pediatrician, or if, it's a pediatric gastro doctor, a pediatric cardiologist, a pediatric neurologist, all of those you'll have to do that transition to an adult provider. There is a significant difference between adult healthcare and pediatric healthcare models. Pediatric care is family oriented and relies on significant parent involvement in decision making. When our children are young, we are the center of their care. We answer the questions, make the decisions, sign the documents, and pay the bills. Their providers look to us for the updates because we know our children better than anyone else. And even as children get older, they've already gotten used to, the parent being the one to answer all that. My daughter, she actually just turned 18. And the last time we went to the doctor, I think she was, I don't know, it's maybe been 6 months ago. So she was 17, a couple months before she turned 18. But even then, the doctor would ask her a question and it'd be something simple. And what brings you in today? And she'd look at me like, are you going to answer for me, Mom? And I'd be like, you got this, girl. Come on. So adult care is more patient specific, okay? And it requires autonomous, independent skills of the patient without as many interdisciplinary resources. So a planned transition, this aims to help manage healthcare better, use services more effectively, and prevent gaps in services. It also helps to prepare yourself and your child for changes in care and ensure everything works well in the adult-focused care. Okay. So goals of a healthcare transition. So the goals of pediatric to adult healthcare transition are to improve the ability of youth and young adults with and without special healthcare needs to be able to manage their own healthcare, effectively use health services, and to ensure an organized process in pediatric and adult healthcare practices. To facilitate transition preparation, transfer of care, and integration into adult-centered healthcare. The role of the parent is to support this gradual movement from overseeing care for the youth to becoming a consultant and answering questions only when asked, which can be really hard for the parent because we are so used to being the one to do that. And to do all of this, good transition prep is essential. So planning for healthcare transition. So planning for healthcare transition should be a collaborative process between the provider, child, and the parent. It should begin early in adolescence, around 12 years of age, but no later than 14. I did not realize that 12 years was, the age to start that until a few years back. Responsibility should be gradually shifted to the youth. And as you begin to shift responsibilities, you will be able to determine if more supports are needed. So the timeline for transition. So this is according to the American Academy of Pediatrics. Planning should begin at ages 12 to 14. And it may seem early, but these years are an ideal time to start introducing skills that build that independence. And every child develops differently, but this is just a general guide for what to focus on at different ages. So 12 to 14, at this age, it'd be time to begin teaching your child about their diagnosis and medications. Start practicing answering provider questions. Learn how to explain their symptoms in simple terms as well. By age 15 to 17, your child should know the name of their medications and what they take them for. They could practice scheduling or confirming appointments, checking themselves in when arriving to an appointment, and scheduling the follow-up appointment at the end of the appointment when you stop at the front desk. Teach them to ask questions about their medications and about their health care. By 18 to 21 years old, your child should have transferred to adult providers. Now, some pediatric providers will keep the child until age 21, but not all of them. At this age, parents should be able to step back, even though it's hard, and allow their young adult to speak for themselves. So, to get there, some key skills that you want to be able to work on teaching your child: communication skills. Helping your child develop the communication skills is a crucial part of the process. You could have your child practice at home answering common provider questions, do a little bit of role playing before going to an appointment, especially, when you know what the appointment's for. If it's just a follow-up or it's that 6-month, check-in with the doctor, it's probably going to be pretty similar to the last one. So maybe some things that were done and asked at that appointment, you could kind of role play before this next one and get your child used to answering those. Medication management is another skill to work on with your child, ensuring that your child knows the names, colors, and purpose of their medication and when they should be taken and at what dose. This was something that my son never could remember, and still to this day at 28 years old, well, he ain't 28, he's the oldest is 28. At almost 25 years old, he's still, if I ask him what the name of his medications were, he couldn't tell me off the top of his head. However, he does have them in his phone. So even if they're not able to remember, it's important that they have somewhere to access that to where they can let someone know, these are my medications, here's when I take them, at what dose and stuff. So teach them if the medication needs to be taken with or without food. That's another important thing. There at 3 o'clock and they haven't called you back. Teach them how to deal with that. So I see Jennifer put in there, is if I asked if I was frozen, was it me or?
You're back now. It was for a few seconds. Yeah.
Okay, gotcha. All right, so self-advocacy, encourage your child to express preferences. They need to be able to select a provider that they are comfortable with, not just rely on what the parent's option is for them or what their parent's opinion is on a provider. Reinforce often that their voice matters. So some barriers. We're going to talk about some barriers to transitioning. So failure to start early can be a barrier because, as you've seen in that video, what happened with my son and I is we never even gave it no thought. We went to his pediatric neurologist and we were told, hey, he's 18. We're not seeing him no more. And we weren't prepared for that. We thought somebody would just give us guidance, tell us what to do, and we didn't get that. And we had to go several months with no neurologist because a referral wasn't put in. So like with us, we ended up having to go back to our primary care physician, have him do a referral to an adult neurologist. Thankfully, the primary care was able to keep Dalen's medicines, prescribed, and we didn't have to go without those. But we did not prepare, and no one let us know, you need to prepare for this. So failure to start early can be, a barrier. Letting go. Difficulties letting go of long-standing relationships with pediatric providers. When you've been with a doctor from, your child's birth or from young age, it's hard to leave that doctor because you all have developed that relationship and that trust and knowledge about, them and your child. And it can be hard to move away from that and be comfortable doing it. Um, and, as a parent, it's not always easy to accept the fact that the person in front of you is no longer a little child, that they have grown up, they're an adult. So limited staff training can be another barrier that you face in medical transitioning. Staff with the adult provider might not be as knowledgeable with medical equipment or diagnoses that your child has. Finances is another barrier. Difficulty finding qualified providers that accept your insurance. Insurance changes because sometimes when they hit that 18 or 21 year mark, the insurance is different. Or they have to reapply for Medicaid. And then gaps in care while waiting for referrals or waiting for that adult insurance. So those are all barriers that can happen whenever you do not prepare early. Poor service coordination, providers that don't coordinate with each other. That was another one with my son. No medical records were transferred from the pediatric neurologist to the adult neurologist once we finally got the referral put in from the primary care doctor. So when he went into the adult neurologist, he was walking in blindly, but basically the adult neurologist had no records, had no idea why Dalen was there, what he was seeing him for. Again, it was during COVID, so I wasn't allowed to go in with him because, he was his own adult, he had his own rights, and I was just mom. And he wasn't able to explain to that neurologist what was wrong with him or why he was there. He just was able to say, well, I had a brain injury from something. And that was basically it. So he walked out of that appointment with, nothing, just, and not even a follow-up appointment scheduled for later. So that was a pretty significant barrier that he faced. And, as a mom, I faced it right there with him. So there was definitely poor service coordination on their part, our part too. Adult providers are not prepared. Not all providers have experience working with young adults with special needs. We have come so far medically. We are so advanced anymore that, years ago, some diagnoses that children may be born with, they didn't make it to adulthood. But we have come so far that these children are living, into adulthood, longer, more fulfilled lives. And, not as many adult providers are as knowledgeable, as what these pediatric ones were that cared for them children throughout their youth. So that can be a barrier as well. Availability of adult providers. So most pediatric specialty clinics are located in children's hospitals and co-located with other specialists, while most adult specialty practices are located in private offices, and it's not usually 5 or 6 different specialties, they're spread out kind of here, there, and everywhere. So that can be a barrier too when you're used to, seeing these pediatric doctors and you're going to Nationwide Children's or CAMC or WVU, and you're able to hit 4 or 5 of your specialists all in one day because they're all in the same setting. When you transition to adult health care, it can be hard to find that setup. All right, guys. Am I froze now? Am I back? It totally booted me.
You're back on.
Yeah, you're back.
Okay.
Yep.
Okay. I don't know. I think it's storming here, but I don't have a window, so I don't know what's going on. I apologize. And I know I've seen where Allie texted me, but I didn't pay attention to how many minutes ago that was. So I don't know where we left off, what you guys heard last. If somebody wants to fill me in, did we even make it through this slide? Were we done with barriers before I froze?
I am not seeing the
Oh,
slide. You have
I'm
to
gonna have to
share again.
reshare because it
Okay.
totally kicked me out for a second. I'm sorry,
Okay.
guys. You'll see that.
Yeah. We did some of this one, I know.
Okay. All
I
right.
think we're on the last one of the last two bullets, probably.
Okay. So, the availability of adult providers. So with that one, a lot of times your pediatric specialty clinics are located within like children's hospitals and co-located with other specialists. So you've got it all right there within reach that, you know, a lot of times you can go to your appointment and okay, I was only going maybe a minute. Thanks, Leanne. And you can hit most of your specialists all in one day, to where adult specialty providers are usually located in private offices, and it's harder to find that, you know, setting of having multiple right there at the same location. So therefore it can consist of more trips, more appointments, longer days, things like that. So the types of healthcare transitions, physician practice to adult healthcare with a new physician, or to adult healthcare with the same physician in the same practice. So that one would be more like if it was a primary care or a family practitioner. Level of support. This here is a good thing to start thinking about again when you begin that transition around 12 to 14 years old, when you start prepping your child, is, you know, the level of support that they are going to need. Decision dependent transition, rely on the caregiver for all medical decisions. Is that what you're, you know, will that be the type of transition it's going to be? Or will it be, you know, a caregiver assist with decisions, but the child, you know, gets to make the ultimate overall decision, and then a completely independent transition. So, you know, those are things to start thinking about as well. I like to say that my son did an independent transition, but he realized really quickly that he needed assistance. So with that being said, you know, he can go to a doctor by himself if he's got an earache, a sore throat, you know, just your typical common things that might happen throughout life. But if he goes to a neurologist where he has to talk about his brain injury and what happened to him and what his diagnosis was, he's going to need somebody with him that can, one, explain what happened to him, and two, relay to him what that doctor just said back to him, because he's probably going to walk out there and be like, what did he tell me? So you got to decide on what that's going to look like as well. Now, some tools to get started. I absolutely love the GOT transition. If you have not ever had a chance to get on there and look at it, I'm going to click this link and we're going to hope it takes us to it. But there is so many resources on this website. They have resources for the parents, they have resources for the kid, and they have resources for the clinicians as well. Did that take us to the GOT transition? Okay. So with this, one of the things I like is they have a little section, is your youth ready to transition to adult health care? Take the quiz. And you click on that. And it might come up. And then you go to find out, and it's just little questions that it'll ask you. Does your child see a doctor that sees adult patients or a doctor that sees only children? You know, and you go through this, you just answer the questions and well, let's see, it's scrolling for me. Does your child know the phone number of their doctor's office? It's not in their phone, but they could find it. I had not thought of, teaching them that or letting them know that. They don't, but I've been meaning to help them put it in their phone. Yes, they have a doctor's office number in their phone, so you can just go through, answer these, and it's gonna kind of give you a rundown on what you need to work on, or hey, they're ready and you're doing a good job. So I'm just going to go through and click and get to the end of it and see what it tells us here. Is your child prepared for a health emergency? Do they have their medical ID information, their medical condition, medications, allergies, emergency contact, and insurance information stored in their phone? And going through this quiz, this also can help kind of give you that aha moment as far as what you might want to start working on with your children. Does your child have health insurance? If not, do you know how to help them get health insurance? I don't, let's see, we're just going to click. And then does your child know how their healthcare privacy changes at 18? Is that something that you have discussed with them? Do they know that, unless you keep the rights, it'll be up to them when they turn 18 to make their own appointment, to pay their own co-pays, to do all of that stuff. And they no longer share information with mom and dad when that child turns 18, unless there's something that legally states that they need to. And get back here. So that's a little bit about the transition. I won't go through all of that. But like I said, there's stuff to, there's a quiz for the parents. And there's a quiz that the child can take themselves. You can kind of test your child's knowledge about their health care and see how much they know to get an idea on, okay, we need to work on this, or, oh, wow, they know a lot more than what I realized that they did. So some things to consider, again, guardianship and alternatives for decision making. Think about what level is needed. Supported decision making, patient advocate for medical decisions, representative payee, power of attorney, medical power of attorney, or other ways. Now, I'm just going to let you guys know I am not an expert in any of them. I just know these are some of the options. But I do know that there are organizations out there that can help with this stuff. So astrive.com, they offer training and support and resources. As far as if you aren't sure, what's going to work best for you and your children, or you do know what's going to work best, and your child's not going to be able to make these decisions themselves, and stuff, and you're going to have the full rights to do that. A Strive can help with that, with what to do. Their legal aid also, they offer some different trainings that talk about the different levels of support as well. So remember, the transition process is complex with many layers. Early communication and planning is key if you want it to go smoothly. It requires mutual respect and understanding between physicians and families. Always involves the parent, caregiver, and the child. So we have reached the end there. I'll leave this up here for a second, but was there any questions or anything that anybody wanted to add or anything? And I'll look, see what was in the chat. I don't know if anything was on that. Yes. And Allie, thank you so much for putting all those links in there. And Brandy, thanks for putting the support group link in. I appreciate you guys so much. I will go ahead and stop sharing.
Any questions?
All right, you guys are quiet bunch today. I think it's the rain, isn't it? That's what's doing it to us.
So I have a question. Do you think, I know you said that you can start transitioning as early as 12. Do you think based on certain diagnoses or just neurotypical children, if that age varies? Like, should you start earlier for certain things and wait longer for others?
So how I feel about that is it is never too young to start talking with your child about their healthcare needs. As long as they're old enough to have a little bit of an understanding on what's going on with them and their body and, what maybe their diagnosis are, then I think that there's really, you can't start too early,
Okay.
So yeah, that's my thing on that. As long as they're able to have a little bit of an understanding on it, and you can have that conversation, the sooner that you can, help them and have that discussion, the better.
Okay.
But yeah, that
All
is a
right.
good question. Thank you.
Yeah. Any other questions or comments?
I just thought this was really helpful and useful. I appreciate it. And I appreciated the video at the beginning about the variety of things. I think people don't appreciate, that suddenly 18 comes along and kawamo, you're facing a lot of things that are new, such as guardianship and Social Security. It's not super hard, but it's very new for a lot of us. And so it's just new territory. And then if you can get that transition, that softer handoff, it would definitely help, because it's hard. It's hard to be, I feel like parents who have children with complex need start each day in a bit of a deficit anyway. So maybe we're a little less able to be organized, you know what I mean? Like, or we could probably all use a lot more sleep. And, so I feel like, it could be hard, but I think this is very helpful webinar. I appreciate it.
Thank you. And then I see Leanne put, what happens if families didn't do what they needed to do before their child turned 18? If you don't do this before they turn 18, well, one, if you go to try to call the doctor yourself to say, hey, I need to make an appointment for little Bobby, they're going to say little Bobby's 18, little Bobby needs to call and make his appointment. Or now, if you have a good relationship with a doctor, I ain't going to say that's going to happen every time, because some doctors, are not going to do that. Like I said, the primary care doctor that I was going to with my son, I was still able to call him after Dalen turned 18 and say, hey, this is going on, that's going on, and he still spoke with me. But he had been with us since Dalen's brain injury. So he had that understanding. And he also knew that our pediatric neurologist kind of failed us on helping us transition to an adult neurologist. So our primary care become our fallback guy to help us get all that mess kind of cleaned up. But there have been some parents that I've spoke to who did not get things done before the child turned 18. They didn't get that medical power of attorney and guardianship and all that. And their child was completely nonverbal. They couldn't walk. They, like they were complete care. And something happened. The child got sick. The child got put in the hospital. And then they had to basically appoint like a guardian ad litem over this kid, well, now adult because they're 18. And the mother no longer had the rights to say what was best for her child and was scrambling to go to the courts and get all this taken care of. So, yeah, that's definitely something that don't wait until their 18th birthday. Start preparing ahead of time, start working on all that so that things like that don't happen. And then again, like I said, with my son, he went into the neurologist, the adult neurologist for the very first time. And because I did not have any legal rights, he had all of his own rights. I couldn't go in with him because it was COVID. And then he wasn't able to explain to the doctor why he was there. The doctor, there was kind of a language barrier as well. The doctor had a really heavy accent. Dalen couldn't understand him. Dalen has that really thick West Virginia accent, way worse than mine. I know I have it, but his was worse. So the two could not understand each other. Dalen walked out of that appointment with no refills on his medication, no follow-up appointment, and nothing but frustration. So, prepare early and try to talk with, the pediatric doctors about doing a referral ahead of time. Talk to them about, okay, when will we transition? Is it going to be when they're 18? Will you keep them until they're 21? That type of thing. Yeah, and then Allie will post the recording of this presentation within a week. It'll be up and posted on our website. And then Rebecca, yeah, she did medical power of attorney for her oldest and got it notarized at the library. Awesome. You're welcome, Leanne. All right. Any other questions or experiences that others have had with transition that they want to share? All right. Well, I won't keep you guys any longer. If you haven't had lunch, go get you some lunch and stay dry.
Yes. All right. Thank you so much, Tina, for presenting for us.
Thank you.
All right. Thanks. Bye, everybody.